So profitability and cost efficiency in AI telehealth. The number. So let's talk money. Money, 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 money. Here comes the money. So one of your doctors out there's favorite topic. How much am I getting paid? I have to come here at 2 in the morning. You better be paying me some good money. So numbers that drive healthcare's digital transformation. So let's talk about saving, right? Sometimes you can evaluate the worth or the value of what you offer to people if you can tell them, hey, well, look, if I'm saving you $100, wouldn't you give me $70? You save 50. That way I'm also happy. So definitely cheaper way to. So one of the big issues in health, Quebec, 8 million population, about of which 2 million do not have a healthcare provider that's assigned to them. And consequence of this is that a lot of patients, when they get sick, they just head to the emergency department. Horrible, extremely expensive for the government, but they haven't gone around fixing that. So they're dealing with multiple degrees of problems in this situation that I just told you. So AI automation will cut hospital workflow costs about $1 billion per hospital, 484 billion in Medicaid savings, single year telehealth savings at a national level. So government saves money, patients save money, and hospitals become more efficient at not losing money retention. So you're saving money, you're saving the government money. So anybody that is involved in this care process should be getting well paid and in some way compensated. So this is now being recognized more and more. And it's overall what we're seeing. In the future, the patients are going to be having more and more online care. And not just doctors. I mean, literally everybody. Nurses, all sorts of people. Who else? Let me ask you something. Let's say everybody now gets like one of these Optimus robots at home. And let's say they teach the Optimus robot how to make a blood draw. Do you understand how this changes like everything for people? It's like you have a private nurse now at home. The Optimus robot can do all those point of care INRs. If you still have people on Coumadin, it can do actually blood draws. It could check orthostatic hypotension. It can auscultate and it could tell you the results. It's like S1 sound doubled. Not only that, actually tell you this patient seems to be in AFib right now, heart rate of 86. I'm auscultating the right lung field and I'm hearing crackles and mild wheezing at the apex. So it's like a private nurse for everybody. So this is major. Understand this is where we are heading. So eventually it's going to be like, Optimus, do we really need to call the doctor? It's like, no, you don't. I'll prescribe it for you. Here you go. Let's go to the pharmacy. Dr. Prime. It's coming. Employer health plan impact, cost reduction. The other thing is, let's say I work with a lot of trucking companies. You have a robot that serves as anything at home. They have, at your office, moves boxes, at the same time doubles as a nurse. Can you imagine my reach out to these companies now? Say, I am partnering with your robot at your clinic, at your office, so that it can conduct some abdominal examinations if I'm suspecting any sort of illness. This is going to create a lot of tools whereby these robots are going to be given stethoscopes that do not have the tubing system that we do, but it will have recording of the sound. Forget analysis by AI. Imagine they had like something not bigger than this. They would scan the sound of the lung field. And this patient's having a asthma exacerbation. They're like 1,000 kilometers away from me. Go to your pharmacy. I'm sending you some Ventolin and some prednisone for 5 days. Call me in 48 hours. Anyways, we're heading more and more into that, okay? Employer health impact, so reduction costs, virtual visits, health plan for employers. Definitely. I see this. This is probably the biggest service that exists in Quebec. Revenue cycle improvements, patient registration, accurately capture patient data quickly, charge capture, identify billing services precisely. This is very interesting, by the way. Let's say here's the thing. I have a patient that doesn't have a family doctor. They come to my clinic, they open and they create their account online. Let's say I have an AI looking at that information. The patient says, my name is, John Doe, but I was born 17th March 1972. It's like, well, this patient is above 50. It's a male patient. The AI could go like, well, for that, he needs to get influenza shot, Tdap if he hasn't had one recently. We could do like diabetes screen, PSA, RSOSI, or occult blood, fecal occult, FIT test, fecal immunochemical testing to detect colon cancer, basically. So all this can be prepared by AI, is what I'm saying. And just from gender, age of the patient. So this is where communication gets enhanced by AI, card capture. So how do you actually bill for a medical visit that would prepare all that? So what else can you automate? Once the AI sees that, okay, this is a 40-year-old woman, we need to do a mammogram, screening mammogram, simple. prepares the yearly evaluation, will ask all the questions to the patient immediately. Do you have any of these conditions? Negative review of systems, age of the patient. It would be good for you to do just a general checkup with this. Can you offer this to patients? Like, do you need to examine a patient in order to do a mammogram that's a screening mammogram, or like fecal occult testing or diabetes checkup with a hemoglobin A1C from venipuncture? Do you need to have them in person to give them that requisition? The answer is no, you don't. DEXA scan. Things are classical. Pneumonia vaccine, hepatitis B vaccination. These are classical things that you don't like. We could automate that to make it efficiently. And then you have the AI going like, this is how you should bill it, get your revenue, and then could eventually do that. Today at 7/20/20, July 20th, 2025, I saw John Doe at 1542. Billing codes are this, screening this. I will make $40, $50. I don't know how much you make, for example. Requisition sent over to the patient. We're pending revision of the results and discuss it over with them. Okay. Receive payments 25% faster with AI. Sends claims error-free. So reducing unnecessary care, imaging reduction, AI care cuts unnecessary imaging by about 24%, ER optimization. This depends on the tools. It's kind of a wide statement. ER optimization, automated triage, reduced emergency load by about 19%. This is where I'm trying to get instant HPI to people here in Quebec, and it's very difficult because the system is very fractioned, and the people at the head, at the top, they have understanding of what needs to be done, but they're not even doctors, number one. Our health minister is an accountant, the health minister. So they're used to numbers, and they don't have experience as far as like, what do we need to do? What do we need to optimize? They know, well, we should optimize things with AI. They just don't know what. So this is where you already know your job as a physician, what you ought to do. You know where this requires energy, and you have experience to some degree. But automation and AI implementation has to be done by physicians. It doesn't make sense otherwise. They have to hire somebody that knows what the hell they're doing. So we already have studies in similar type settings that automated triage reduce emergency room load by 19%. When I wrote to the government, I told them, this is the following thing that you should do. We have services like Info Santé 811 in Quebec. So these are triage systems. People call over the phone. They say, I don't have a doctor. I need to be seen. I feel sick. These are my symptoms. This has to, instead of going directly to a nurse that just talks to the patient, it has to go through an AI filtering process like instant HPI. The patient fills in the form sends it over to the nurse. Now, the nurse has all the information organized and triaged by the AI. The AI says, well, this is a patient that passed out. This is triage, what we call here P1. This needs to be seen in the emergency department because we don't know what it is. Could have stroked out, could have been orthostatic hypotension, like a vasovagal episode. It could be something far more serious, right? It could have been an epileptic seizure. Who knows? So this is already arranged by instant HPI for the actual nurse. And the nurse then even has a referral to the ED physician that she could send to the patient, explaining the entire process of all the information that was captured so that the physician doesn't have to do it again, or the nurse at the hospital do it again. This can all be done online. This would significantly decrease, because the other problems here in Quebec is, let's say the patients they don't have a family doctor, they get sick. They go to that nurse and then she goes like, well, I can have you seen tomorrow because this is different. You have like a dental infection. The AI says you could use Advil and have him seen by a dentist tomorrow, or he can be seen irreversible pulpitis, whatever diagnosis the AI thinks you have, dental cavities, dental fracture, who knows, right? The AI will prepare a document that can then be provided to the next person taking care of the patient in a streamlined fashion. So this, I recommend it to the government here to put it in the DSQ, which is the online medical record for all patients, so that it's accessible to doctors in the emergency department, and the patient doesn't have to bring a paper that he printed. If it's done at the level of the Info Santé, it could be recorded directly in what already exists as a communication tool that's available to all physicians, nurses, and everyone else, including the patient. It would be even more transparent, very reliable. It's already perfectly secure. It's how the government communicates imaging results, lab results to patients, gives them their vaccination history and their medication list. This is how every person in Quebec has access to that. So this should be the new standard for consultation in Quebec. It's not to call 811. It's for all these people that don't have a family doctor. They should fill this form online, and this will streamline a lot of the work that's going to be done at that point by the AI. Is going to be available for all doctors, including the doctors that will ensure the follow-up after the patient has left the emergency department. How do you communicate that to people that have no clue what the hell I'm talking about? You're a doctor, you're hearing this, you're going like, it's impossible. And that's where we are. So this is my new challenge and my new fight. It's getting this to the people that are involved in making these decisions. Hopefully that we will ultimately get a more streamlined and efficient tool for the practice of medicine and providing care to the population here in Quebec. So operational efficiency, patient volume increase with same staffing levels of AI-enabled clinics. Let me explain this a little bit better. Increase with same staffing levels, operational efficiency. One of the statistics we had when we were actually analyzing, we were using Canadian Bureau of Labor statistics that there's already studies out there that say how much time a physician spends, like of every hour that he spends in patient care, like what percentage of that hour is spent in direct patient care, writing notes, writing prescriptions. This already exists for studies. So we took that information and then we multiplied it by the degrees of efficiency that we brought down some things. For example, it's very hard to tell people this is exactly how much it would help because there is tremendous amount of variability in healthcare from a patient to the next, unless you work in an extremely narrow service. So like we only do one thing. Like for example, in Quebec, we have something called winter clinics where they basically they see you for sinusitis, pharyngitis, all these upper URI type symptoms, bronchitis, all these things that happen typically in winter months, it gets worse. So the government created these clinics called winter clinics. If you have a winter clinic, it's easier to measure these things. But when you have a patient that comes in for depression, another one comes in for a follow-up of ADHD, another one comes in for a UTI, then another one comes in for a workers' comp. The time is very different from a case to the next. Different complexity requires more or less work. So the patient volume, what is it referred to? So let's say you make, like I discussed earlier, if you work 8 hours a day, and what we have from some studies with AI scribes, I'm not talking about my technology. By the way, my technology is not even mine. It's put together by me, but it's using Llama. I use Llama, but I've used Opus, I've used ChatGPT, I've used DeepSeek, I've used pretty much every language model that I tried out there that you can have access to. These language models do the work. There's something doing the work for you behind all that. Another good thing is that some of these models are open source. So the government could extremely easily have an open source model and run the entire thing there and pay no AI fees to anybody. Do you understand how this is absolutely insane? A simple MacBook, this computer you see here, MacBook Pro, that's maybe 3,000 Canadian dollars, can do like 200 consultations an hour. 200 consultations an hour. The average physician is like struggling by having more than 6 patients an hour. This can do 200. So we can have like 6 doctors, 8 doctors, easy. Everything done for them through an AI. The AI is installed in the computer on a private server. So this is where we're going to, okay? Operational efficiency. Definitely. So in a previous conversation I had today, or a presentation, I said that we had a study that said that the average time that a physician takes is 16 minutes for a note. It gets narrowed down to 3 minutes when you get an AI scribe. It was 13 minutes per case, 25 cases a day. We said it was about 70% of your time as a doctor is being instantaneously overnight solved and done for you instantaneously. This is not normal, like it's not the normal evolution of medicine. I earlier spoke about buying a stethoscope from EcoHealth that costs $500. That's a simple evolution. We're talking about operational evolution. This 17% patient volume is a fallacy. It's not accurate. So we have multiple studies saying all these things. The truth is that it's not even reasonably quantifiable. It's not reasonably quantifiable. What will reflect is your practice. When you start using these technologies and you see how your practice is like significantly better, you're going to see what I mean. It's the way to go into the future. Combined impact across healthcare, revenue optimization, improved ROI, enhanced productivity. It's all the same. It does the work for you. AI does your work for you. What can you trust it with is the first question. What can you do for me that's reliable? So this is where you either see it, you have to see a demo, or you look at technologies yourself and you can build it yourself through things like My GPTs, which is another method that you could use. You combine different tools. You should see my video on the different tiers of automation for medical practice. So you understand you bring different tiers of AI automation together, different tiers of automation of which AI is a tool within the different tools. You bring them together and then you have pretty much 90% of your work done for you. That's how it works. Key takeaways, immediate ROI. This is one of the most impressive things. When you're a builder like me, programmer, physician, AI enthusiast, and you start working with these technologies, you hit these walls that you could spend 10 hours trying to fix. When you fix that problem, it's like night and day. The evolution in AI technology and programming is beyond the realm of human capacity because we're using AI to program AI. So AI is becoming ever better and more efficient at doing complex things from simple commands. So this is how you do it. Staff optimization. One of the biggest issues I had and that I wanted to correct in my medical practice was dependency. I want to have a simple medical practice that doesn't make me dependent on having a nurse, having a secretary and all these things. As much as possible, I want to have a simple practice that allows me to do what I like. So staff optimization. What happens if and this happened to me in the past where I had a secretary, she gets sick. Man, people get sick. She calls off. I have 20 patients scheduled. So what happens now? There's only me and my secretary. You know what happens? Bad things happen. So now I have to either double as a secretary, or I have to start asking people for favors. If I don't hire people consistently, who's going to come for one day on an emergency basis call to do all the things that they need to do at my clinic, not knowing how my clinic operates? It's a nightmare. So simple things for solo practice physicians are definitely better. And I love using Spruce. And that's why I love the asynchronous model, because it's more efficient and it's more physician friendly. Will give you not only independence, but you can also have communication wherein your secretaries are also on the application and they interact with your patients, or both of you interact with patients through the chatting system. Revenue cycle, AI billing solutions, future-ready early adopters gain competitive financial advantage. Yes and no. Early adopters allows you to secure a part of a market, but what the hell does early adoption mean right now? Everything in AI is early. Not only is it early, it's advancing so fast that it's hard to even say like you're adopting anything. Like early adoption in the past was when you were like 5 years ahead of everybody else. What is 5 years today? It's like overnight. They have new models doing things that are far more accurate. We already had like in the last week, we had a publication done that they had rare, and by the time you see this video, it probably won't even matter. But what they found was that they had some AI computer systems that were competing with doctors, and they were able to detect things that the doctors were not even thinking about. The AI was thinking about like a possible genetic defect that was a rare cause of pruritus, and that was actually the problem. So all the doctors are like, man, we're pretty useless nowadays. It's like, yes, you are, my friend. So you either use technology, it's like you're not useless, like you gotta let your ego go a little bit. And you say, well, the new way is we have better tools now to help patients. So embrace these better tools. This is how you move forward. This is how you become future ready. You have to be accommodating to these new technologies that will do your work for you. So it's even better for you. It's more efficient. It's more accurate. What are you waiting for? So that's it for this video.